So we are looking at a question from 2018 of AIMS exam, where it states that if carbamazepine is added to ongoing valproate therapy, what adverse effect is risked? A. Pancreatitis, B. Thrombocytopenia, C. is hepatotoxicity, and D. is hyperammonemia. Okay, so out of all of these question answers or options, the most appropriate would be hepatotoxicity. Okay, now this is a little bit controversial question, and the answer is also not that straightforward, but the only explanation that is there in Kaplan-Meier is hyperammonemia, which is rare, more common in combination with carbamazepine, associated with coarse flapping tremors and response to L-carnitine inhibition. This is the only thing that is written. But the only thing is that I want to tell is there is a difference with what we see in experience and what is limited to the textbooks. Okay, so the exam key will always say hepatotoxicity, but Kaplan-Meier says about only hyperammonemia, which is which is in Kaplan-Meier referred to as more common in combination with carbamazepine. Okay, however, from clinical perspective, hepatotoxicity becomes a greater risk, okay, rather than hyperammonemia. Although we should also keep in mind hyperammonemia is also a very commonly seen side effect, but not as common as hepatotoxicity. Okay, so whenever we go for monitoring for these patients, okay, so in monitoring of the patients, we order LFT, okay, we order LFT as well as serum ammonia. Okay, now we always order these two labs so as to monitor both of them at the same time. Okay, so the purpose of this question is to assess not only what is written in the textbooks but also to assess what you are seeing on a day-to-day basis. So first of all, this question is not only applicable in our psychiatry but also certain patients who are having little difficult to treat seizure medications. Okay, so the studies are also coming and the observations are also coming from that clinical perspective, from a neurologist perspective of treating a difficult to control epilepsy as well. Now usually whether in psychiatry or in epilepsy, we avoid this combination of valproate and carbamazepine because it is wrought with pharmacokinetic adverse interactions that results in adverse events as well as unpredictable dosages fluctuations, because carbamazepine and valproate, both of them influences each other's pharmacokinetic metabolism. Okay, so the best scenario would be not to combine this at all. If, however, it is getting combined, then we should be thorough with the monitoring as well, not only through the labs, but also physically checking for signs of hepatotoxicity, okay, as well as serum ammonia, and LFT must be ordered as well. Okay, thank you. Hope you have learned something from this.